give clarity to a lot of the steps that have been taken, the things that are going on in this office, just all the elements of the changes that have occurred since COVID-19 impacted our community. And I want to begin where I should always begin, by expressing gratitude to the men and women in this organization. We have about 3,500 employees that work in all different capacities, detention, sworn, and civilian. And these employees have families and loved ones and friends that they have great concern for, as much as they have concern for their own safety. Yet they continue to provide dedicated service to this community in the face of not only the threat to personal safety because of the nature of our business, but the threat of health safety because of the nature of this pandemic. And oftentimes I hear questions and concerns regarding the inmate population, operations, and absolutely we need to answer those things and make sure that we are conscientious in providing care for those in our custody. I just want to make sure that we never forget that these men and women are the ones facing the greatest challenges, and we need to make sure that we show them our appreciation and give them recognition for the work that they're doing. And what makes me most proud has been the response. We have seen very small numbers in those who have been unavailable for work. Even with the adjustments we've made to the work schedules, they continue to provide exceptional service, and they have been exceptional at improvising to make sure that we get the job done. So I just wanted to start off with that. And as I speak to that, I think it's also important that I recognize our command staff, who has taken on considerable new responsibilities in trying to organize these elements. So now I will get down to the things that have been issues of concern brought to my attention, and we'll begin with the first slide, which references detention. Coronavirus, as we know, was impacting other parts of the world prior to the turn of the calendar. But in January, early February, we recognized that there was a high likelihood that this would be impacting our nation in some capacity. We recognized that one of the most critical elements to ensuring safety was to find a way to manage the jail population, to see if it was possible to reduce the numbers in our jail system so that we could create social distancing, that we could dedicate space solely for isolation if we had anyone who was symptomatic relative to COVID-19, but to also create space and manage a potential impact on our employee base. If our detention officers in the jails were to become sick, that means our numbers would be reduced, which means we would not be able to provide safety and security at the high level that is necessary. So in working with some of my colleagues in law enforcement from around the county, we had conversations about making some adjustments to what we would define as misdemeanor offenses where there is not an ongoing threat to public safety. And the majority of the police chiefs through the Valley, as well as our office, empowered our employees, our deputies and our officers in the streets to be conscientious in their decisions relative to if the possibility existed to cite and release or long form the circumstance, that they could do so in an effort to reduce our jail population. They were also reminded that if it is a threat to public safety, to act as we've always acted, and we would respond accordingly. Since implementing those guidelines, we have seen our daily bookings go from an average of what is about 225 to 300 bookings per day down to about 100 to 150. Additionally, I took steps some time back to suspend the work furlough and work release program. The work furlough work release program involves inmates who are deemed to not be a threat to the community. They spend evenings and weekends in the jail, and during the day they go to their jobs. Because of the nature of this program, that meant that they were being exposed in the public and then returning to the jail system. And the possibility of them being exposed and bringing that exposure into the jail was heightened. So I took steps to suspend that program, but while doing so, initiated conversation with the courts and the probation office and prosecutors so that they could make a determination if they felt it was appropriate to get court orders to release those detainees to home, and that at the conclusion of the pandemic, they would then have to return and complete their sentence. Those entities took legal steps to do so, and I believe it was about 150 or so inmates that were in the furlough work release program were released to home. Since taking these steps, we have seen our jail population go from what was about 7,100 in January to today's number, which are about 5,500 inmates. Some of the other steps that were taken were the suspension of inmate programs where volunteers or outside organizations come into the jail system and provide extracurricular programs, some which are extremely important. I would tell you they're all important, but some are critical for the benefit of the inmate population. Drug recovery programs, faith-based programs, other things like that that help our inmates overcome and cope with some of the challenges that they have in life and provide support. This step was taken because of the health crisis. We will restore those programs as soon as we are able to, as long as it doesn't undermine our efforts to promote safety and health inside the jail system. We instituted a process where when anyone is booked in the jail, there's already a screening process for everything from mental health, medical needs, financial aspects, all different stages. One of the enhancements was specific to COVID. So every inmate will be reviewed by a correctional health employee to make a determination if that person is potentially symptomatic or may have been exposed to COVID while outside prior to coming into our custody. If it is determined that they meet that criteria, they would be isolated, and they would be isolated with medical oversight. And that medical oversight would continue until the Correctional Health Services determines that they are no longer a health risk, in which case they would be put into one of the pods. Another adjustment that we made was that we have groupings of inmates. So when someone is newly booked, because those are the ones that pose the greatest threat, someone new being introduced to our jail population, we group them and we keep them collectively together in smaller groupings. And that continues for 14 days. They are moved as a controlled population over the course of 14 days. If anyone inside that population starts to become symptomatic, they are also drawn out and put under medical observation, and we continue to observe the rest of the population. And once it is deemed that there are no indicators that they're symptomatic, then they are placed into a facility. We have limited our movement of the facilities so that our populations all stay in place and stay together. So if there is an exposure, we can isolate it. One last item, when they're in medical observation, if it requires a COVID-19 test due to their symptoms, the time frame to get results back is 7 to 8 days. We're looking to see that reduced as the new tests seem to be providing quicker results. Next slide. As I already stated, we implemented detailed inmate housing plans to reduce movement and to better identify exposure. I brought 2 masks today. Everyone here understands the challenges we're facing in acquiring PPE equipment. It is not solely in the medical field, it is in law enforcement for first responders. So since inception of this issue, not only have we looked through governmental resources to try to acquire these, but we've taken upon ourselves to look into the private sector to determine if we have business leaders who can help facilitate acquisition of these items. We have 2 different types of masks that I'm showing you today. This is a surgical mask. This is an N95 quality mask. I'm sure you've heard the terms before. N95 eliminates the majority of the particulates that could potentially expose you to COVID. This one enables you to keep yourself from exposing your own vapors, anything through a cough or through speaking that could be exposure for another person. These masks are issued to all of our inmates. I want to state that again. These are issued to all of our inmates. They get 1 mask. If they request additional masks, they are provided. We are trying to manage to make sure they're not wasteful and they get full use out of these. But this is our effort to help the inmate population protect themselves and our detention staff. These are difficult to acquire, and the pricing, as you know, has been escalated considerably due to demand. So we're trying to be responsible to enhance a layer of safety for our inmate population, and we do not deny them these masks. But we do expect them to be responsible in the usage of them. These masks are issued to our employees, detention staff, and deputies in the field, and they make the determination as to when it is appropriate to apply those and try to get best use. We have ordered these in volume. We have seen our back stock diminish. We have orders that have been on standby for considerable time frames. I can tell you that we have one order to meet our needs that I know has been suspended and delayed numerous times. It's my understanding that they're redirected due to the request of the federal government or FEMA, and you just hope that eventually they come through so we can make sure we have backstock for our employees. We expect to get a considerable order in next week, but to be safe, we've taken additional steps. We're working with several private vendors who are producing cloth masks, much like the one this gentleman's wearing over here. It is my hope to acquire enough to issue 2 of those masks to every one of our employees. Those masks will only be for the employees, not for the inmate population. And once we acquire those, they can be washed, they can be reused, and we can acquire the K95 filters that are inserts for the masks if necessary. The inmates are also issued bars of soap. They have access to cleaning supplies. And I've heard that there have been concerns or complaints that we're only cleaning the inmate space once a week. We provide the inmates with sanitizer and other chemicals so that they can keep their spaces clean. This has to be a joint effort. Inmates must be responsible for their own health, safety, and well-being as much as we are in order for us to accomplish this. We do not have the resources, nor do we have the ability to go in and clean their space every day. We need them to help us help them. So we provide them with the materials, we do clean once a week, and then we ask them to be contributors to keeping those spaces sanitized and clean on a regular basis. I understand that other organizations charge inmates for medical services some fee. We do not. There are no fees assessed. Everyone receives whatever medical attention is necessary while they're in our custody. We have had our internal housekeeping staff prioritize sanitation of touch spots, door handles, doors, things that are frequently touched by both inmates and by our personnel. They spend and dedicate more time to cleaning those surfaces because they're the highest levels of exposure. Some of you may be aware, but we recently distributed tablets to our inmate population, and I want to describe how these are used and what the limitations are. The tablets are much like an electronic tablet you may have in your own home. They are the property of and the responsibility of an outside vendor. They come at no cost to taxpayers. We are not responsible for their upkeep. We are not responsible for the replacement. We are not responsible for the functionality. But with these tablets, we worked with that provider to design and designate what content is appropriate for inmates. So it allows them access to make direct contact with family member and friends, both through an application similar to like a FaceTime and through text messaging. It also allows them access to certain educational material as well as video. There are limitations on what they can see. There is no inappropriate material. There is no videos that are would be deemed as videos for children. There are restrictions to ensure that whether they're a predator or a violent person, that the content that they're able to access is not contributing to their behavioral pattern. Additionally, there are apps on the tablet that help them identify and connect with resources. We were fortunate these tablets were distributed before COVID hit, because as we reduced the population, we recognized that taking away some of these programs would increase anxiety and potentially stressors leading to violence. The usage of these tablets gives inmates a positive, constructive distraction so that they can cope with the circumstances and our detention officers can better manage the population. Because of COVID, the third-party provider is allowing for free phone calls and communications with family members and friends during this time frame. So there are no restrictions on them speaking to and communicating with loved ones or friends during COVID to ensure that they were up to date on the status of anyone they care about, and vice versa. They can provide their own status. Additionally, they get 30 minutes of free video visitation per week, free access to educational books, games, radio, and 3 hours of TV per day. Some may feel like that's a luxury. That's not our intention. When COVID ends, these tablets will become the responsibility of inmates. So when they use these resources, there's actually a fee attached for some of the resources, not the educational pieces, but others. These tablets can generate anywhere from upwards of $5 million annually that rolls back into the jail budget and can be utilized only for inmate services. So the money they spend cycles back so that it pays for programs for the inmates so that taxpayers are not burdened with it. So it actually pays for itself and reduces the cost to the taxpayers relative to things that are necessary for detainees during custody. One thing I just want to note, we have heard from some of the organizations outside the jail system, case in point, the Phoenix Rescue Mission. Since delivering these tablets, they have seen their volume double of contacts from inmates to their organization asking for help and support upon their release. I'm going to speak about the patrol division for a little bit. Our MCSO dispatchers have initiated COVID-specific questions during calls for service. So normally they would ask about threats, guns, knives, violence, things of that nature when our deputies respond. That continues, but now they will do an interview related specifically to health concerns so that when our deputies respond, they can better prepare for what they may encounter there if there's someone symptomatic. If we believe the call can be handled by phone, meaning there's no ongoing threat, it is not a crime in progress, it is concluded, and it's really just a report, then we're deferring those calls and they're taken by phone as reports unless a supervisor determines follow-up to acquire evidence is necessary, in which case they'll respond. So sergeants will review these calls to ensure that dispatchers and they agree upon what resources are necessary to meet the demands. The district lobbies are closed. The ride-along program was suspended. As I stated earlier, our deputies have been issued N95 masks and gloves. Our patrol divisions are empowered to use their discretion as it relates to nonviolent misdemeanor offenses. And I talked about the high-touch areas and sanitation. We used to have deputies using reusable gloves. We've discontinued that, and they're all carrying their PPE gear and utilizing as needed. Deputies are required to clean and wipe down the patrol vehicles at the beginning and end of each shift, and as needed throughout if they transport an inmate to ensure the health and safety of anyone that comes into our custody. Commanders provide a review every day in personnel regarding personnel and staffing needs. My executive team meets every day, either by phone or in person, a mixture of the two, to go over everything regarding our staffing, any spikes in leave, any impact on the organization to make sure that we are addressing this in real time. We implemented staggered start time schedules. So what does that mean? When you arrive to work, normally there may be a briefing, whether it's in the jails or in the field. Instead of having all of our employees show up at once, we set them in 5, 10, or 15-minute increments so they are not having the briefing and they're not having as much direct contact. We're trying to support social distancing, and if necessary, supervisors will meet with them in the field and provide them with updates to make sure that they are in the loop on any critical issues. We established alternative work schedules for both our civilian and administrative staff when appropriate. Sworn staff that were assigned to administrative positions, they could be investigative in nature, they could be administrative, they are now required to be available for duty in the field. So if we have a need in the field, if our deputies see a depletion in resources, anyone who is in a position that was not traditionally a first responder position is on standby to be utilized to ensure that we have supplemental forces. Same thing applies to district detectives. We've used alternate schedules, and we also make them available for patrol if necessary. Let's talk for a moment about the governor's executive orders. Very challenging because we know that it asks our public at large to abide by some guidelines for the sake of public health. Not everyone is agreeable to these terms. Not everyone is taking the steps necessary to contribute to flattening the curve, which means that our deputies are responding to businesses occasionally who continue to function, believing that it's unnecessary for them to abide by these orders. Our deputies are working extremely hard to provide educational contacts and try to inspire our community members and business leaders to support this effort and to gain buy-in. We have had occasions where businesses refuse to abide and support this, and they've had a heightened volume of clientele or customers in their business. After numerous contacts, communications, and warnings, there have been occasions where our deputies have issued citations, not because they want to, not because they choose to, but because they have to, because we have some folks who are not willing to support our effort. And here's what's bothersome to me. Not only because of the fact that we are all in this together, which we hear repeatedly in order to address this health crisis, but these men and women who are first responders, whether it is our deputies, whether it's detention officers, grocers, medical professionals, all the industries that cannot shelter in place. And I will state this, no one chooses to shelter in place because they want to, it's because we have to. But for the professions where you cannot, their lives and their health is in a heightened risk. So for the individuals who refuse to abide by the governor's directives, it's not just affecting you, it is affecting the quality of life of those who are putting their lives on the line. And that is, quite frankly, just selfish and unacceptable. So although you may feel a certain way, please do not jeopardize the health and safety of the first responders and the healthcare workers and make their jobs more difficult. The more quickly that we can resolve this, we can all get back to a healthy community. But it disappoints me that these men and women show up to work every day recognizing these threats, and we have some who are willing to challenge this authority right now for their own agendas. And I hope that they'll understand I'm not trying to scold them. I'm trying to bring to their attention the seriousness behind this. Our deputies go home to their families and their children. They want to make sure they do so in a healthy capacity. Next slide. All Maricopa County health plans cover COVID-19 office visits and tests at no charge for our employees. And I'll give you a brief recap of numbers quickly. And I'm going to give both right now. I should have given inmates earlier. But as it stands, we have 21 inmates who are in medical observation, meaning they're symptomatic, potentially for COVID, and being observed by medical staff. 3 in Estrella, 1 in 4th Avenue, and 17 in LBJ, which is one of our bigger jail systems. 0 inmates thus far have tested positive according to correctional health. We have not had and I need to find wood somewhere, this is a particle board, to knock on wood because I recognize we're fortunate right now. Our staff, that includes civilians sworn in detention, we have 15 civilian employees on leave, 57 detention officers, and 7 sworn. Those numbers are not specific to COVID. It might be because they are on leave to care for their family. It could be symptomatic family members, or they themselves are symptomatic. Right now, we are waiting on results for 1 of our civilian employees, 9 of our detention officers, and 1 of our deputies. Thus far, we have had 1 positive test result for COVID in the organization, which was publicly announced a few weeks ago. That was a member at headquarters who has since recovered. We are very fortunate, but I will tell you it's due to the disciplines and the conviction of the men and women in this organization with the things that are within their control. And get back to some of the healthcare issues. Some of the local healthcare providers, such as Banner, Phoenix ER, and Medical Hospital in Chandler, they're providing priority testing for first responders and other critical infrastructure personnel who are experiencing COVID-19 symptoms. The Maricopa County Employee Assistance Provider, which is Magellan, has opened a 24-hour crisis line for our first responders and healthcare workers. They can call the hotline and speak directly to a certified licensed mental health clinician. It's not just wellness right now, it's also mental health because of the stressors that we're facing. We instruct all of our employees that they're symptomatic to stay home. We repeat that often, and we have a checklist when everyone comes to work that they have to self-review to determine if they are symptomatic in any way, shape, or form. And we're asking them to make a sound judgment, or their supervisor if they determine that there's anything that gives them cause for concern, so they stay home. I have put in a request to acquire temperature gauges, the electronic ones that you can run across the forehead. I think they're infrared. I apologize, I don't know exactly what they are. If we do acquire those, we'll utilize those with our staff if possible, so that we can take an additional stage to make sure that our staff is healthy and not exposing anyone else to the virus if they're asymptomatic. We continuously send updates to our staff and reminders. Some of the things that we've done, next slide. We've created a working group which started on March 17th. This is members of our organization throughout all aspects, all lines, and all areas, so that they can have input and they can assist us in communication to ensure that it's two-way. They're making recommendations on things that we can do to improve safety for them and to be more effective for the needs of the community. On March 17th, we began our weekly discussions with the Arizona Department of Corrections, the FBI, and the Sheriff's Association. We speak once a week to share best practices and concerns so that we can work collaboratively to address this issue. On the 19th, we started the Employee Pantry. This is something our organization is very proud of. Our employees go to work every day and may not have access to toilet paper, to diapers, to baby food, to all the things that can be challenging for every family. But again, they're not going to have the ability to go shop whenever in order to acquire these items. So we started a pantry where we can help each other. Employees can bring in items for their peers, and we solicit contributions from private industries and from organizations. We have been able to help 72 of our own families because of this and provide needs for them that were not readily available prior to it. It is ongoing, and we're seeing an escalation now where meals are being donated and other items. I recognize that the needs of the community are no different than our own, and I'm not trying to portray it as though ours are more important. But with the challenges we face, I appreciate the sacrifice and the support of the community to care for our first responders and the members of this organization so that they don't have to worry for needs that they can't acquire on behalf of their family. On the 20th, many of you may be aware, I crafted a memo stating that I believe that our new jail, the ITR facility, and the attached buildings should not open at that time because of COVID, but that it was possible it can be utilized for treatment of COVID-19 patients if the Board of Supervisors and the county manager deem that there was an effective use of that facility. That is still under review. I told you we split the executive teams to reduce exposures. We've had 50,000 surgical masks. Over half of those have been distributed to the inmate population as well as to some of our employees. Another 75 will be delivered this week. That should take us through at least the next 30 days. And you can see the number of N95s that we've acquired. That inventory is depleting quickly. We're touching on a few things, and then I'll wrap up and take your questions. Our jail population as of today is 5,500 inmates and change. Last year, this time, it was 7,400 inmates. That is critical because it allows us to create space to isolate inmates when necessary. It creates more space for our detention staff, and it helps us to better manage the population for all aspects of this challenge that we face. We are a public safety organization. We're dealing with a public health crisis. That does not mean that we should have an excuse to neglect our core responsibility. The men and women out in the streets are doing an exceptional job of managing crime to the best of their ability, in addition to the responsibilities of COVID. As an example, you know that just recently our fugitive apprehension team apprehended a child abuser who had brutally abused an 11 and 13-year-old. This was a Phoenix PD case, and our employees were able to work in collaboration with Phoenix PD to locate and arrest that person. Just about 2 weeks ago, they arrested a homicide suspect. They've arrested about 15 major felons in the past 2 months just for the FATE team. Our Special Investigations Division has had numerous seizures involving heroin, fentanyl, marijuana, money, guns, paraphernalia. We have seen a consistent volume of calls for service and consistency in the crimes that occur in our community now in relationship to last year and the year before at the same time frame. So we are not seeing spikes, nor are we seeing dips in the volume of crime or calls for service. I know for some the issue and concerns over domestic violence escalating or suicides, our numbers are trending very consistent historically, which tells me it's a good thing we're not seeing an escalation due to COVID, but at the same time we're not seeing these numbers decrease, so the demand on our employees has not changed. Yet they're delivering an exceptional level of service with all these challenges. Some of the things that are different now, in order to be conscientious, when our deputies stop someone for a traffic violation, our deputies have a plastic bag. We are not contacting any items of the driver or asking them to contact anything with us. We open the bag, they drop their driver's license in it, our deputy goes back to the car, and if they determine that they're going to issue a citation, the citation goes into the plastic bag, and the plastic bag with the license and the citation is handed over to the driver of the vehicle. Trying to think if there's anything else that's critical for me to cover before I express some gratitude. So what are my concerns? Well, my concern is COVID-19 and its effect on our community. That's why we're talking about this. But we recognize that the revenue in the state of the economy has been adversely impacted, which means that our supervisors and our county manager are going to have difficult decisions as it relates to the county budget. This organization was actually just reaching stability in our workforce. It had been at a deficiency for, I can't tell you how many years, goes back, probably a decade, and our detention workforce had gotten down to some of the lowest numbers it's ever had. Our deputy side was closing the gap also. I am concerned that the impact on the economy will affect our ability to continue to fund this organization properly, and that if we have to make cuts, which I'm not saying that that might not be the responsible thing to do, it will affect public safety and our ability to manage and run this organization effectively for the needs of the community. But that's an us problem, because there's a lot of men and women out there who had jobs and businesses before this started, and they may not be able to return to those. So I'm not speaking about this as though we're the only ones impacted. This community is impacted. We'll continue to work with the Budget Office and the Board of Supervisors to be thoughtful in those decisions while still trying to deliver public safety at an exceptional level. I do want to express gratitude to the organizations that you see up there, and if I miss any, I apologize, but these are organizations that have made considerable donations to help this organization during this time. The Arizona Cardinals, the Arizona Diaper Phoenix, Bashas Carl's Jr., Clearview Title and Escrow, Crumb Cookies, Domino's Pizza, Door Lake Creations, Fountain Hills Mayor Dickey made some contributions. The Greater Phoenix Leadership, Grotto Cafe, Hickman's Farms, Home Depot, Maricopa County Distribution, Midwest Food Bank, Oregano's Pizza, Queen Creek Fire and Medical, Salvation Army, Specialized Innovative Design, Serrano's Mexican Restaurant, Sonoran Sky Elementary, Swift, U-Haul International, U.S. Bank. It is important that I express gratitude, not just to these folks, but to the community members who've been supportive of this organization. I was speaking earlier today to one of the representatives from the Suns, and he was talking about, actually it was the Suns president, Jason Rowley, talking about how they wanted to help this organization. And as we were talking about it, we both expressed, because his employees are affected the same way, this job is hard enough. Anyone who's going to work in the face of these circumstances or not employed, it's difficult. But a little appreciation goes a long way. So when you see someone in the community or a business step up like these that I've named, stating that they just want to be supportive and help in some way, that inspires our employees and reminds them why it's so important to show up to work and to get it done. And as we say often in this organization, or I speak to the employees and I state, if not us, then who? If these men and women don't show up, then who's going to keep the community safe? And they keep showing up. So as we talk about your concerns and the inmates and other things, I just want to again remind everybody, we should never overlook the fact that men and women are putting on uniforms and coming to work in a difficult time in spite of all the challenges they face and the health risk. With that, I'm happy to answer your questions. I'll go left to right. Go ahead.
Sheriff Penzone, you mentioned that there were 21 inmates that are in observation right now. Have any of them been tested? If so, how many, and how are you deciding which of the inmates in observation gets tested?
It's a great question. If you couldn't hear it, he's asking of those who are in observation, who gets tested, how many have been tested. Correctional Health is the medical provider on behalf of the county, and they're the ones who have the doctors and the nurses, and they make the determination. It's not something that we have control over, that we have direct involvement with. My understanding is if they deem that the person is symptomatic and they're not able to identify a cause other than COVID, then they'll apply a COVID test, which are limited. And I can't tell you the volume or the number of those who have been tested thus far. I do know that the tests have increased considerably over the past few weeks, but I'm sure if you reach out to county health, they can give you the exact numbers as of today. What's most important to me is making sure we isolate, and if they have a positive, that we identify that as quickly as possible so that we can determine who that person had exposure to prior to the positive test. But I apologize, I don't have the exact number of tests that they had. I just know that they've told us there have been no positives, and every test they've applied has been a negative result.
As a follow-up, are they isolated together? Are they in like a hospital bay type situation, or are they in separate cells isolated from each other as well as the general population?
So it's circumstantial. If there are times when they are isolated independently, depending on the aggressiveness of the symptoms, and when I say isolated, again, we only have so much space to work with. But there are circumstances, I told you, when we have these 14-day stays of new inmates coming into the system, if they are symptomatic, they're pulled out of that population, and we continue to observe that population to ensure that no one else becomes symptomatic, and they're maybe brought into a space where they are, I don't want to say exposed to, but again, with limited space, anybody who is symptomatic is managed in that way, and as it escalates, they're drawn from that space and isolated and tested. I assume you're next if we're going clockwork. Yeah, no, they're employees back there, they're fine. They ask me questions all day.
All right. You've gotten some calls that there are work furloughed inmates who are COVID-19 positive. Do you know if that's true, or what do you want to say to families who are worried about that?
We don't have work furlough inmates in our custody.
Do you know of any of them who are home or positive, though?
I am not aware of, if they're home and they're positive, they're no longer in our care. So that would be, whether it is HEPA or whether it's their own private information. We are unaware of anyone. Now, keep in mind, we've released work furlough, how many weeks ago now? Want to help me? It's been probably close to 3 weeks ago, right? 3 weeks. So they're outside that 14-day time frame. So I am unaware of anyone who was a historical inmate, and that could be anyone who's released also. Keep in mind, as I stated, we are still booking in 150 people a day on average, which means 150 per day normally are going out the door also. If any of those individuals are exposed or COVID positive, we're unaware of it, but in our population, we haven't had anyone who has tested positive.
Sheriff, I got my report on the phone. Go for it.
I have a question about the businesses that you spoke about earlier. Can you identify the businesses or the type of businesses that were not abiding by stay-at-home orders, the guidelines given by the governor's office, and what was the citation, and for how much typically are those?
So the one that I'm aware of, there may be more than one, but I think it was like a bar restaurant.
Sheriff, you may want to repeat the question.
Okay, so the question was, if you couldn't hear him, he was asking about the time that we had to issue a citation because someone was in violation of the governor's order, and what the business was that was cited. It was a bar restaurant, I guess is the best way to describe it to my knowledge, and the exact citation which we had to review through the prosecutor's office was, Chief, you want to help me out with what the code was, or Ann, do you know? There's a specific code, and I can get that for you and follow up, but it pertains to the violation of this order, and it was vetted through the prosecutor's office. Again, I want to repeat, our hope is to not cite anyone, and it only occurs in those escalated circumstances where we repeatedly return, but it was reviewed, and we were told that it is constitutional and lawful that if we issue on that citation, and my hope is that we'll get coordination, and whatever is determined in the court process is fine with me. My number one priority is health of the community, so we just want to deter behaviors that jeopardize health safety.
It's only one?
There may be more than one. The only one I'm recalling was the one I'm describing, so I'll check and get you an exact number, but it's no more than one or two to my knowledge, unless there's additional citations.